The appendicular skeleton includes all of the limb bones, plus the bones that unite each limb with the axial skeleton. The bones that attach each upper limb to the axial skeleton form the pectoral girdle. This consists of two bones, the scapula and the clavicle. The clavicle or collarbone is an S-shaped bone located on the anterior side of the shoulder. It is attached on its medial end to the sternum of the thoracic cage. The lateral end of the clavicle articulates or joins with the scapula just above the shoulder joint. The scapula or shoulder blade lies on the posterior aspect of the shoulder. The clavicle has three regions: the medial end, the lateral end, and the shaft. The medial end, known as the sternal end of the clavicle, has a triangular shape and articulates with the manubrium portion of the sternum. This joint allows considerable mobility, enabling the clavicle and scapula to move upward and downward and anteriorly and posteriorly during shoulder movements. The lateral or acromial end of the clavicle articulates with the Acromion process of the scapula. This is the portion of the scapula that forms the bony tip of the shoulder. The scapula has several important landmarks. Between the superior and lateral borders is the location of the glenoid cavity or glenoid fossa. This shallow depression articulates with the humerus bone of the arm to form the glenohumeral joint. The scapula also has two prominent projections. One is the hook-like coracoid process. On the posterior aspect, the spine of the scapula is a long prominent ridge that runs across the upper portion. Extending laterally from the spine is a flattened and expanded region called the acromial process. The acromion or acromial process forms the bony tip of the superior shoulder region. There are 30 bones in each upper limb. The humerus is the single bone of the upper arm, and the ulna and radius are the paired bones of the forearm. The base of the hand contains 8 bones called the carpal bones, and the palm of the hand is formed by 5 bones called the metacarpal bones. The fingers and thumb contain a total of 14 bones, each of which is a phalanx bone of the hand. The humerus is the single bone of the upper arm region. At its proximal end is the head of the humerus. The head articulates with the glenoid cavity of the scapula to form the glenohumeral joint. Located on the lateral side of the proximal humerus is an expanded bony area called the greater tubercle. The smaller, lesser tubercle of the humerus is found on the anterior aspect of the humerus. The distal end of the humerus has 2 articulation areas, which join the ulna and radius bones of the forearm to form the elbow joint. The more medial of these areas is called the trochlea. The trochlea articulates with the ulna bone. Immediately lateral to the trochlea is the capitulum, which is a knob-like structure located on the anterior surface of the distal humerus. The capitulum articulates with the radius of the forearm. Just above these bony areas are 2 small depressions. These spaces accommodate the forearm bones when the elbow is fully bent or flexed. Superior to the trochlea is the coronoid fossa, which receives the coronoid process of the ulna, and above the capitulum is the radial fossa, which receives the head of the radius when the elbow is flexed. Similarly, the posterior humerus has the Olecronon fossa, which is a larger depression that receives the Olecronon process of the ulna when the arm is fully extended. The ulna is the medial bone of the forearm. The proximal end of the ulna resembles a crescent shape with the C-shaped trochlear notch. This region articulates with the trochlea of the humerus as part of the elbow joint. The inferior margin of the trochlear notch is formed by a prominent lip of bone called the coronoid process of the ulna. The posterior and superior portions of the proximal ulna make up the Olecronon process, which forms the bony tip of the elbow. The radius runs parallel to the ulna on the lateral side of the forearm. The head of the radius is a disc-shaped structure that forms the proximal end. The small depression on the surface of the head articulates with the capitulum of the humerus as part of the elbow joint, whereas the smooth outer margin of the head articulates with the radial notch of the ulna at the proximal radioulnar joint. The neck of the radius is a narrowed region immediately below the expanded head. Inferior to this point, on the medial side, is the radial tuberosity, which is an oval-shaped bony protuberance that serves as muscle attachment points. The pelvic girdle or hip girdle is formed by a single bone, the hip bone or coxal bone. Each hip bone, in turn, is firmly joined to the axial skeleton via its attachment to the sacrum of the vertebral column. The bony pelvis is the entire structure formed by the two hip bones, the sacrum and coccyx. Unlike the bones of the pectoral girdle, which are highly mobile to enhance the range of upper limb movement years, these bony components are the ilium, the ischium, and the pubis. The ilium forms the posterior-inferior region of each hip bone. The large inverted U-shaped indentation located on the posterior margin of the lower ilium is called the greater sciatic notch. The ischium forms the posterolateral portion of the hip joint. The bony projection separating the lesser sciatic notch and greater sciatic notch is the ischial spine. The pubis forms the anterior portion of the hip bone. The pubic body is joined to the pubic body of the opposite hip bone by the pubic symphysis. The pelvis consists of four bones, the right and left hip bones, the sacrum, and the coccyx. The three areas of each hip bone, the ilium, the pubis, and the ischium, converge centrally, forming a deep cup-shaped cavity called the acetabellum. This is located on the lateral side of the hip bone and is part of the hip joint. The large opening in the anterior-inferior hip bone between the ischium and pubis is the obturator foramen. Like the upper limb, the lower limb is divided into three regions. The thigh is the portion of the lower limb located between the hip joint and the knee joint. The leg is specifically the region between the knee joint and the ankle joint. Distal to the ankle is the foot. The femur is the single bone of the thigh. The patella is the kneecap and articulates with the distal femur. The tibia is the larger, weight-bearing bone located on the medial side of the leg, and the fibula is the thin bone of the lateral leg. The bones of the foot are divided into three groups. The posterior portion of the foot is formed by a group of 7 bones, each of which is known as a tarsal bone, whereas the midfoot contains 5 elongated bones, each of which is called a metatarsal bone. The toes contain 14 small bones, each of which is a phalanx bone of the foot. The femur, or thigh bone, is the single bone of the thigh region. It is the longest and strongest bone of the body, and accounts for approximately 1/4 of a person's total height. The rounded proximal end is the head of the femur. The head of the femur articulates with the acetabellum of the hip bone to form the hip joint. The narrower region behind the head is called the neck of the femur. This is a common area for fractures of the femur. The greater trochanter is the large upward bony projection located above the base of the neck. The lesser trochanter is a small bony prominence that lies on the medial aspect of the femur just below the neck. The linea aspera is the roughened ridge that passes distally along the posterior side of the mid-femur. The distal end of the femur has the medial and lateral bony expansions, called the lateral and medial condyles of the femur. The lateral and medial condyles articulate with the tibia to form the knee joint. Anteriorly, the smooth surfaces of the condyles join together to form a wide groove called the patellar surface. The patellar surface provides for articulation with the patella bone. The patella, or kneecap, is the largest sesamoid bone of the body. A sesamoid bone is a bone that is incorporated into the tendon of a muscle where that tendon crosses a joint. The patella is found in the tendon of the quadriceps femoris muscle. The patella articulates with the patellar surface of the femur and thus prevents rubbing of the muscle tendon against the distal femur directly. The patella also lifts the tendon away from the knee joint, which increases the leverage power of the quadriceps femoris muscle as it crosses the knee. The tibia is the main weight-bearing bone of the lower leg, and it is the second longest bone of the body after the femur. The proximal end of the tibia is greatly expanded. The two sides of this expansion form the medial condyle and the lateral condyle. The top surface of each condyle is smooth and flattened. These areas articulate with the medial and lateral condyles of the femur to form the knee joint. The large expansion found on the medial side of the distal tibia is the medial malleolus. This forms the large bony bump found on the medial side of the ankle region. The fibula is a slender bone located on the lateral side of the leg. The fibula does not bear weight. Instead, it serves as a primary point of muscle attachments. The head of the fibula is a small knob-like structure located at the proximal end. The distal end of the fibula forms the lateral malleolus, which forms the easily palpated bony bump on the lateral side of the ankle. The posterior half of the foot is formed by 7 tarsal bones. The most superior bone is the talus. This has a relatively square-shaped upper surface that articulates with the tibia and fibula to form the ankle joint. The calcaneus is the largest bone of the foot, which forms the heel. The anterior half of the foot is formed by the 5 metatarsal bones. The toes contain a total of 14 phalanx bones or phalanges, arranged in a similar manner as the phalanges of the fingers. The toes are numbered 1 through 5, starting with the big toe or hallux. The big toe has 2 phalanx bones, the proximal and distal phalanges. The remaining toes all have proximal, middle, and distal phalanges. Thank you for watching.